Welcome everyone. I hope you all can hear me. I'm told that I can begin. So this is, I think, our second virtual PPA support group meeting. So I hope that people are managing to key in okay, and that you're beginning to get used to the new world that we inhabit. We're expecting about 80 people today, but there will be a number of cameras, I think, being shared by more than one person. So we're expecting probably over 100 people. We have a support group team, a direct support group team, who are available for people to contact for support at any stage, not just obviously within the context of this meeting, but that goes within your wider lives as well, because we know that there are lots of social restrictions, etc., in place, obviously, still over the country. And the support group team is available for people to contact at any stage. We'll give you the various names and details as we go along today, but just so that people feel that you're not alone during all of this. There are a couple of things just to say in terms of bringing people up to date about people. We've got a new rare dementia support group admiral nurse, Hannah Gardner, be working with a team who I think many of you will know, with Nikki Zimmerman and her team, and focusing on complex care needs and the later stages of disease. The contact at raredementiasupport.org, which is the contact number, is the place, or the contact email is the place to reach Hannah or other members of the direct support team if you need to. What we need to do is just go through today's agenda. So I've got essentially not many announcements to make, but we've got a couple of things to say, and then what we'll do is move to there's a video which we have a member of the RDS support group, Helen, talking to Anna Faulkner, who's our dedicated speech and language therapist, and also at the moment with Chris Hardy and with me running the PPA support group. So Anna and Helen will be talking about diagnose somebody with a mixed PPA, and then we move to a second video that will be first video at about 10 or a few minutes after 10 now, the second video about 10:30, in which Joey, who is an RDS member, very kindly talking to me about her dad's diagnosis of semantic dementia. And then hopefully about 11:15, we'll try to then be ready to move to a Q&A session, which we have a panel of people, and that's really to give you all an opportunity to send in questions. And then finally, what we'll do is have a closing video, which is really a video from our major backers, who are the National Brain Appeal, who support the work of rare dementia support more widely. That's Eva Tate and Alexis Skebby, who will be speaking to you about some of the work that they've been doing and the work of the National Brain Appeal before the meeting closes. So that's the general overview of the day. Now, the Q&A panel session, we might get people, just so that if this all works, with the technology, to come on and show you who they all are. So if we get people to show their cameras now, but these will be the panelists for the Q&A session after the videos today. People come back on. You can see people coming back on. Now, some of these faces will be familiar to you, but obviously those of you that haven't had a chance to come in to sort of meet people face to face, it's a slightly unusual situation. So I'll just try and say, and might get them to wave when we say who they are. So Helen, first of all, who I've mentioned in connection with our first video today. She's an RDS member, and very kindly joined by her husband, Simon. Get Simon and Helen to wave to you. Then Joey, who is the other RDS member that I mentioned, is actually on holiday, and she'll be joining us over the phone. So she can't join at the moment, but we'll be able to hear her, we hope, technical aspects permitting. Anna, I've mentioned, Anna Faulkner, senior speech and language therapist, co-lead of the PPA support group with Chris Hardy. And Chris, I don't think needs much introduction. but he is currently, I'm not sure actually if people are up to date. He's changed, or he's expanded his role slightly, in that he's, I think probably since the last support group meetings, become officially the RDS, Rare Dementia Support Education Officer, as well as the Senior Research Fellow, working mainly with me on PPA-related conditions. So he has the RDS, the PPA support group limb, and the scientific limb to what he does. As usual, he's been very instrumental in getting today's meeting actually ready, making sure that all the different ingredients were in place. And Nikki Zimmerman, who again probably doesn't need much introduction, but she runs the direct support team for RDS, who are the sort of online resource that I mentioned. Now, so that's welcome to all of the Q&A panel, and we hope that that will be a useful exercise for you all later today. What we wanted to say is that people should feel free to ask questions of any of the panelists. So now, again, we're all coming to terms with the technology, but there is a question box on the right-hand side of your screens if you've joined the webinar. Or failing that, if the box isn't actually visible, there's an orange arrow, which I can see at the top of my little box here in front of me, which you can use. And the idea is to, if you click on that arrow or you look at the box, you get, if you enter questions into the box, they'll be sent through to Chris, who will direct them to the appropriate panel member, because we've all got slightly different sort of perspectives, different backgrounds, etc., to try and make it most useful for you. So Chris will coordinate that, but all we really like you to do is to send things through. There are some questions already through in advance, which we've had through, and hopefully that will pick up on some of the big themes that are you know, interesting people, worrying people, etc. at the moment. So we've already got some good questions, but please do feel free to send through new things. Now we'll get you to do, I think if I can ask the panel to stop sharing their webcams, we'll obviously bring people back a bit later. The one thing to say, we're quite keen to build up a resource of questions so that people can obviously go on benefiting from answers and things if they're useful. And from the last webinar that we had in May, they've been edited and put up, subtitled, and they're featuring, I think, on the Rare Dementia Support Group website now. So we'll send out a link after the email, an email link after the webinar is finished. We wanted to mention that we've taken quite a lot of feedback from the last webinar. Obviously, that was the first one of its kind. And you know, we'll try and make things, if we can, a material, like for example, the videos today, as PPA friendly as we can. It's obviously one of the big issues that people with PPA face is communication. This is particularly challenging now because of all the technical challenges in the world in which we're now living. It's very hard to subtitle things live. That probably is a bridge too far for our technology, but we'll try and be as, you know, get them up there as speedily as possible, so that people want to come back to them and have another look, a bit more leisure, then that becomes more useful. And obviously in the interim between meetings, people are very welcome to send through questions, etc. if things arise. We'll try and get back to people promptly about that as well. Chris, as one of the many initiatives that he's got going, is very keen to build up a resource of what we might call meet the experts, or conversations with the experts. And one very important difference that we'd like to put in place, which is slightly beyond what often people think about as meet the experts, which is people like doctors and scientists sort of talking a lot, is that we feel quite strongly that the real experts are all of you who live with the condition. And so what we want to do is give all of you a forum for coming out and talking about the condition, the real experts, and sort of making that conversation a true conversation, rather than just having people, you know, from medical backgrounds or scientific backgrounds talking about conditions they haven't lived with. We thought we'd get people who live with the condition to talk about what it's like living with the condition, and hopefully between those two perspectives we'll get something more useful. So that would be something that you'll see examples of today. So obviously your feedback about the videos that you see today, which is the first of these kind of, this part of this wider initiative, if you like, would be very helpful for us to go, so that we can hopefully improve their usefulness for all of you in the future. And then we'll put the full lot of videos then online will be for the uncut versions, if you like, unedited versions. Obviously, in the meeting today, what we're showing is a somewhat edited version of much longer videos, but the full thing will be available. Always to say, and this is very important, well, there's actually a couple of thank yous. One, the first of them is to the team. Now, the team is an expanding team, but I don't know, we might try and get them to actually show who they all are along the way sometime today, so you can start to put faces to names. But Millie, Claire and Livy, who are working behind the scenes to make sure that things go as smoothly as we can. We can't deal with all technical glitches with the vagaries of the technology, but we'll do the best we can. And it's very important to say that this trio have a wider role within the RDS Direct Support Group team. So they come in and they join these meetings, but they're part of a much broader kind of support that we have for across the whole of the dementia support, which is an increasingly big job, actually. I know that a lot of you probably have had contact with them, maybe by telephone or maybe by email in the different sort of support calls as part of this direct support team that we have. But it's extremely helpful to have them here today because, of course, there has to be a lot of cogs turning before we can kind of get a meeting like this up and running. And the final sort of thank you, or the big thank you, is really to all of you for making ultimately this whole group possible. And it's one of, if not the largest of the rare dementia support groups. It's one of the largest of its kind in the world for PPA. And I think that is a testimony mainly to all of you, and particularly to thank the people who've made the commitment to join today for the first time, because obviously that is a big step for a lot of people. And we do hope that it will be useful. We have lots of breakout resources that hopefully will go on, meaning that this group is useful and a way for all of you to communicate also with one another and not just with us after the kind of in much smaller groups, or even just, one-to-one sort of, after the meeting is done. So we want to kind of see this as work in progress, really, as an ongoing thing. All right, so we need to crack on because we've got a bit to get through. So the first thing, so just to say that the first video, the first thing to sort of main item today, there's quite a lot of kind of information in the video you'll see that comes out, so we don't need to say too much about it. But Helen, again, to really express our thanks to Helen. She's a diagnosis of mixed PPA, very generously kind of contributing to this. Anna, as we've mentioned, you'll see. Just to say that if this video and the other one, in fact, if they don't work, they should hopefully work for the majority of you. If you just send a message through in the question box, and then there's a YouTube link. So don't worry, obviously it'll also be available for looking at a bit later as well. So don't worry if you can't for some reason see it in real time. But I think having said that, we might get Millie to play the video, and I will now disappear for the time being and see you all a bit later. So we'll go on with the first video now. Thanks so much.
Well, I've always been quite a talkative person. I've always been thinking I've been quite clear. I'm a music teacher in schools, and 4 years ago, I was delivering a lesson, and I realised I kept missing out. I couldn't find a word. It literally your brain stops and you can't think of that word. And you've got 30 pupils looking at you and you're frightened, really. And that was the start of thinking, it's just not right. What is that? And that was the start of it. And I really remember even the class that I was looking at the time, in the time that I was having that experience.
So did you then go to your doctor, and what happened when you went to your doctor?
Well, I went on another year thinking it's just going to be something middle life stuff, and I thought that's going to fine. And then I was on holiday with my husband, and he said, really, you're struggling to find words, and I can see you're having difficulties. And my older daughter said, just go to the GP just to check it, and I went to the GP, and I fortunately the GP I saw had worked with dementia patients, and he said to me, don't worry, it's okay, but I'll refer you to the Memory Assessment Centre. He didn't mention any word about dementia at that point. It was just like memory assessment. I had no idea about what I was going to find. So yeah, that's what I had, a kind GP who heard more than what I was saying, probably.
Oh, fantastic. You're very lucky to have such a
I
kind
was.
GP. Yeah. And so then he or she referred you to the memory assessment team. And what was the next step there?
Well, that also was a very good place, because it was a nurse who took me the memory test. And that is really, it's really meant for dementia people who have memory loss. So I looked Mrs. Professional in the whole thing, and I got a very high score. But she saw that she could hear sometimes that I was making grammatical mistakes. So then she had to refer her to her boss, and the boss said, let's go and have a scan.
Okay.
That was the process.
So the consultant doctor in that team.
Yes.
Yeah, that makes sense. And then you had some scans, and
yes.
Is that when they gave you a diagnosis?
No, they gave me the scan, and then I went to a more specialist memory assessment centre a little bit further away from my home, and an amazing doctor there, and I had 8 weeks of an hour each assessment, which was going into the details of the cognitive disorder.
Yeah.
And that was really hugely comprehensive.
Yeah, I bet it was. So they asked you lots of questions.
I did most of the tests that I have done many times in subsequent times. So I know all about some of the pictures that one needs to be required to see. But they were very comprehensive.
Yeah.
And then on the back of that, I had something called D-Day, Diagnosis Day, and they asked my family to be in the same room with me when I was the diagnosis.
And how did that go? How did you feel?
Well, actually, on the day, I could see the people that are delivering it. It's not going to be good news. I could see they were warming up for the news, but it was a tricky one. For me, it felt relief because I knew that I had problems.
Yeah.
For my family, it was very difficult for them because at that moment of time, there was not any understanding anything about PPA, not really, because I was, first of all, my husband went into, he went into, anyway, some word to express that he said, do we need to do the DVLA about your driving license? So straight into this rather practical thing about being having dementia, and I had not even thought of having dementia.
Yeah.
So in retrospect, I would say it would be kinder for people to say you've got aphasia first of all, and then you can access help with rare dementia support.
That was one of the next questions I had for you, really, which was how did you get further support around your communication? So was that through the rare dementia support?
Well, it was actually, yes, because Chris Hardy, he gave me the arrow. It was the Discover with Rosemary, and but then I started reading the newsletters on the Rare Dementia site, and then I found your voice. So then I rang you up, and you're the first person probably that had any experience of patients with PPA, and it was like a light bulb in my life, and I will never forget that.
I remember that conversation. I really remember when you first contacted me. It was late afternoon, and I was at home, and we managed to. I was working from home, and we chatted, and I remember we talked for a long time, didn't we? Like 45 minutes or so.
Yeah, because like I just say, how does anybody know anything about PPA really? And then you said to me, go back to your GP and refer for speech therapy. So I didn't have that the diagnosis day. I had that with you. So then I went back to the GP, and then he referred me to Queen Square, actually, because at that point I didn't have any, either the system wasn't working in the other place. So thank goodness I had the fortunate bit to be coming to Queen Square. And also then you told me to get speech therapy at that point of time.
Yeah.
So thank you.
Oh, you know, you're welcome. You then were the one who then went and found it. And I remember that I'd sent you some research articles as well, didn't I? To share with and some information to share with your family. I'm going to go back a bit. Sorry. We always talk so much when we chat, don't we, Helen? But one of the things I wanted to ask was, what did you first do when you first started speech and language therapy sessions?
I think it's tricky, isn't it, to think how. I know that what I needed to do was do some repetitive with my words that I find difficult. So I would know when they go through with the words, I'm okay up to 2 syllables. When it gets to 3 syllables, I get really uneasy. So I have now got a strategy to write down the words that I don't find it. So I would always write down my words that I struggle on, and then I practice them. I can say now thermometer, which I find a lot. That's quite tricky. So then you realise that you are moving your mouth in a different way, in a little bit more positive way, to get the word out. So that's good, because at the beginning of aphasia, I think that's a good idea to think about how you're getting your words out in a way that you didn't used to have to do.
So almost maintaining those words because you're practicing them.
You practice them. You do practice them. And if you practice, for me, practice does actually help, definitely.
Brilliant. Yeah, that makes so much sense. And actually, when we were preparing for today, your daughter thought of another question we could talk about. And your daughter had mentioned this question, and she suggested that I ask you what it feels like to live with PPA on a day-by-day basis. How would you answer that?
She's a perceptive child, and well, yeah, I would say in my previous life, I would say I was a very confident, outgoing person, and I think that's taken away from me in that sense, because you're always anxious and a bit nervous of things. And then you always feel a fog in your head. That's what you feel, a fog, and that never clears really. So that's how you can describe it, as a fog. And sometimes when you have more sleep, or I'm playing my piano, playing the piano is that's fantastic. And sewing. So if you have a quiet day, you don't have to do too much. You think, well, this is okay. This is very okay. One side of life actually being realistic, then you always more tense. You can't go to get a coffee and not feel relaxed, because you know you're going to ask something and it will go blank, and then the person's going to look at you blank, and then it gets even worse because you get more tense. And I think that's living with aphasia for me at the moment. And that's just me. You can't say, I don't really have anybody else, but that's what I'm like. So you lose what you were, but you have to embrace and be kind to yourself with the fact that you haven't got what you were. That's what I would say. Yeah. But I teach music. I have a language of myself with music, and that helps my life, I think.
I remember during lockdown, we had a few conversations, and one of the things you mentioned, you'd done something musical. You hosted like a street orchestra.
Yeah. Well, I am that is my life really. So I'm here as a aphasia patient, but in my professional life where I live, I'm just a different person, because I'm still functioning very well with music. So in lockdown, I did I have my pupils, and they were all out in the street with their music instruments, and it was lovely, tiring, but it was joyful. So I'm lucky that I have music in my life, and I think it helps with aphasia, because when you're playing the piano, you feel that your brain is unknotting somehow. It's the one thing you can do. For me, I mean, obviously it's not, but if you feel tense with it, with too much noise in your head, you just go and play the piano, and it feels like you're unmoving the knots in your head.
Amazing.
So,
that's an amazing analogy, unknotting your head. I was just going to mention that earlier on you were saying that when you watch TV programs, you find the subtitles really helpful.
They have to be on.
They have to be on.
Yes.
Is there anything else that you would like other people who are on the same journey to know about? Any tips and hints? Any advice?
Well, I think that practical one with people doing diaries of their families, so they don't have to do so much conversation. I would think that was a good tip for people. I would say always get some speech therapy, which is very useful. So I think that's a good tip. I would say sometimes when I'm tired, I just write down things for Simon. I have got no energy to, particularly maybe when it's a nutritious scenario, and you don't want to get into a battle with anybody. Write down things and give a choice on a bit of paper. So I would say, I remember you giving us some picture things. Sometimes pictures will be working. So I would say, the more you can take out too much language in terms of your conversation, sometimes when you're tired, don't expect those people to have a time to talk. It's not the time that they want to talk. So then at that point, you could just write down something, little post-it things, and I think that would be kind to people. So I think that's practical.
The last kind of question or point you wanted to make, I think, when we discussed today in advance, was you wanted to talk about in retrospect, with your diagnosis, what you would want offered. So if you could go back to the beginning, what would you want to be offered to you?
Well, if I go back to where I went to the doctor, that was fine. Going to a memory assessment, I would say fine. Having some tests was fine. But at that point where diagnosis given, I would say that changed how, and going back there, I would say in those situations, I don't know how many centers are in the country. There can't be so many more. You couldn't say to people, the first thing you can offer is the Rare Dementia Support Centre, without a doubt. Go to the professionals that know about PA, and don't straight away say you've got dementia, because it's not kind for that person. They've got to understand, first of all, they've got a primary progressive. Nobody knows what they're talking about. They wouldn't know it's progressive. We don't know what you're talking about. So and yes, putting two together. So making sure they understand that the scan that they've seen is where it's affecting the brain, and there's nothing you can do about that diseased part of the brain. But what you can do, it's the only thing you can do, is to try to get your communication better with your partners, who are going to find, with the family, who are going to find it more challenging to find you shrinking with your world a bit. So I think it's that primary bit of getting that place sorted out, so that people will understand about more PPA.
Right, well, thank you so much. And particularly thank you to Helen for being so courageous as to come on and actually give us that very vivid insight into what it's like to actually live with PPA, and to Anna for leading us all through that. It illustrates so many things which we can't pick up on right now, but I think, you know, everything from the importance of things like people's attitudes to things, music, these are huge things that people hear time and time again about, and the whole business of what we talk about when we talk about these diseases, using terms that people either might not understand, the jargon like primary progressive aphasia, or these buzzwords like dementia. And I'm old enough to remember when cancer in medicine was a no word, you know, literally it's the C word, medicine, and that changed when we had treatment, essentially effective treatment for cancer. So I'm hoping that dementia will go the same way, but it is true that it's a very laden term at the moment. So thank you so much to both of them. We also want to give, I know he's present on the call, Helen's husband Simon, a chance to give his perspective. And I think in the Q&A session, what we're hoping is we will have a chance to pick up on all of that and more as well. And if you've got questions, we encourage you, as always, just to try and send them through in the question box, and we'll see if that all works. And hopefully we can then get back to you about that. But we need to push on and show the next video. We've got another intrepid support group member, Joey, this time, who was talking to me this time about a different PPA diagnosis of semantic dementia, which I know many of you are battling with. So we'll proceed with that, but just to say again that if people are tuning in or just coming in with there's some technical issues, that if it doesn't appear, if the video doesn't appear there is a YouTube link. People message in the question box, we'll send you the link, and you will be able to watch it later at leisure as well. So what I'll do is ask Millie, our sound and light expert. Without further ado, I'll disappear for the moment, and we'll push on with the second video, and then we'll rejoin for the Q&A after that. Thank you. Be helpful because I know that your dad has been very kind and helped with our research in the past, but we want to try and focus a little bit about how his illness has unfolded today. So I thought it might be helpful if you just tell us a little bit of background about what he did for a living and kind of, you know, the sort of circumstances before the illness began, just to set the scene.
Okay. Right, so my dad worked as a salesman for his whole life, so probably for about sort of 30, 35, no, probably more like 40 years before he unfortunately had to stop work, and he was selling packaging mostly for pharmaceuticals. He was very, very successful at what he did. So in our family, it was my dad, my mum, and myself and my brother. And then, so my mum sadly suddenly passed away about 6 years ago. And around about the same time, I think just prior to that, Dad got diagnosed. He didn't actually tell anybody. I'm not, for that reason, I'm not exactly sure when he got diagnosed. So whether he sort of had suspicions just before Mum died, or if he had actually been diagnosed. He then told us probably about 6 to 8 months after Mum had died about his diagnosis. And in all honesty, at that point, it was almost a bit of a relief, because I think Dad was kind of behaving differently. And I think for me and my brother, we kind of thought it was because of, you know, depression or the sadness from Mum. So it gave a lot of answers at that point. And I think we obviously had heard of dementia, and with the type of dementia that Dad's got, obviously didn't know anything about that. And it is a scary thing to hear that someone's got dementia. But yeah, I think at that point it solved a lot of questions, and we kind of didn't really know what was to come.
What were you told when he was given the diagnosis after the GP referred him?
So at that point, because Dad was then living on his own, and myself and my brother, you know, don't live at home anymore. We weren't present when he was diagnosed. Okay. It was more a case he then passed on his understanding of what it was, and then obviously we did then go for a meeting with the doctor that had diagnosed him initially. And the early things that I remember being told were that at some point, I think, well, we got told it's slow progressing from what they understood, which was obviously sounds good, but you have no idea what that means because you're comparing it to who knows what. We were told that his type of dementia is to do with loss of language, and that at some point, if he lived that long, he would get to a stage where we wouldn't be able to understand him and he wouldn't be able to understand us. And that they're sort of the things that come back to me as like the main things that we were told at that point.
I'm just quite interested, because it's difficult to be told, for anybody to be told diagnosis by themselves, particularly if they may have some trouble with understanding. How did he explain it to you? Do you remember what he said to you when you told about it?
So we were out on a dog walk, I remember that, and he, because obviously at that point he still had a lot of language, it was just the odd word here and there. And I remember he just said that he had some bad news to tell us, and that he'd been diagnosed with semantic dementia, and and I think he did emphasize the loss of language would be the issue, but that was kind of the only thing that I think was made clear. So, you know, it was, and again,
Yes.
at that point, because Dad was just forgetting the odd word, you just sort of, you did know it was going to get worse, but you kind of can't visualize that. And it was more a case of, okay, he won't remember what a daffodil is. That's all right, we just call it a flower.
You sort of mentioned stubbornness and being more rigid about things. Your mum had noticed. Do you just want to maybe talk about some of the changes that you've noticed in his sort of non-verbal behaviour?
Well, the first thing that kind of comes to mind is not that he wasn't a person that would hug his children, but he now is, you know, he craves that physical affection.
Right.
He wants a hug. He wants you to sit next to him all the time. So yeah, really, that definitely has changed.
Do you think that, because actually that your experience there might be atypical? There'll be many people living with somatic dementia who'll say just the opposite of that people get quite switched off about other people. But we tend to say it can go one of two ways. It's almost as if people could flip between extremes. And do you think it verges on inappropriate reactions?
Yeah. And particularly with strangers or people that he doesn't know as well. You know, he'll put his hand on someone's leg or put it on his back, or even like poke them somewhere that, you know, in the face because he's pointing at something. And
do you think that sometimes people find that quite amusing inappropriately? Do you think his sense of humour has changed at all, or is it still recognisably his? What would you say?
He always had a very good sense of humour. He's a very funny guy, and I'd say he still sometimes will have a sort of cheeky chappy about him, but it's completely not what it was in the past.
In what way?
Because he doesn't have the language to make those jokes that he would have done, and he wasn't, you know, it's not like he would have actioned funny things all the time. He did do that sometimes, but yeah.
So what about his taste in comedy and humour? Has that changed at all?
He doesn't. I wouldn't say I wouldn't even say he really knows what. I wouldn't know what his taste in comedy or humour is, because I don't think he really has it. You know, he doesn't really laugh that much anymore. If you get a laugh out of him, that's unusual.
I have heard that from other people with somatic dementia who, excuse me, and we've looked at this a little bit. People will say that they just become generally quite humourless. Sometimes people with other types of dementia can become begin to like a lot more slapstick or physical, or even things where not very nice things happen to other people. But with somatic dementia, that can happen in frontotemporal dementia, other types of frontotemporal dementia. But somatic dementia, often just loss of humour seems to be something that people see.
And I would say that there might be at times that he does find things that you think, you know, that's not funny, and he does find it, you know, someone gets hurt or something. So he would recognise that he shouldn't be laughing at it.
Yeah, no, that's very insightful. What about kind of the more rigidity, stubbornness side? Has that got more prominent?
Yeah, so you can't interrupt him. He has to finish what he's saying. He is always right, even though, like, you know, 100% he isn't. He has to do it the way that he wants to do it. Yeah.
And timekeeping?
Timekeeping is very good, actually. So everything he does, like lunch, is always at 1 o'clock. He starts cooking his dinner at 5:30.
Inflexibly, it must be. Does he get anxious if it's not that time?
Yeah. And like on the phone, he'll tell me, not necessarily in an anxious way, but that's a point of conversation, is that I have my dinner half an hour later. You know, he's very time conscious.
And, you know, very common history, I don't know if you recognise it in people with somatic dementia, is, you know, they've had an appointment or someone's coming at 7 o'clock, and, you know, they're out at 30 seconds past 7, they're out the front looking and checking and saying,
waiting for food in the pub, like constantly, how long's the food going to be? Where is it? Like harassing people for it. Yeah.
And are there any rituals or things he does, particular kind of behaviours or things he does repetitively that you've noticed?
Yeah, so like I'm just trying to think of examples. Like with the television, he always has to have his remote controls in exactly the right place and always switches them off and on in the same way. And like I say, breakfast at 10:30, does his emails. He has a very, there'll be different things that happen on some days, you know, he'll go into town or something, but yeah, there is definite patterns.
So just in terms of your experiences though, I wanted to ask you, if apart from the driving, if you generalize that out, what aspects, because your dad living alone is obviously challenging, what can you identify or just highlight things that you've found particularly difficult about that to tell other people about?
So I think well, there is so much that is so difficult. I think one of the, just as a general, I think as his daughter, or my brother as his son, I think you constantly feel like you're not doing enough, and because we live so far away as well, you know, you keep thinking like, should we be closer, you know, if we could pop round more, and then actually recognizing that what we are doing is the very best that we can, and it's important that we aren't sacrificing our whole lives as well. I think my auntie's been very good at reinforcing that and sort of saying, you know, what would your dad want if he was in his right mind? So I think dealing with the guilt of we're not doing enough, we're not doing enough, we're not doing enough, when actually for dad, he's not going to get better. He's very depressed as a combination of mum's death, the illness, everything, which is completely understandable. And that isn't going to improve. It's so sort of being okay with what you're doing. And then I particularly over the last few months, we've had a lot of people trying to help, which is great, sort of, you know, local people and people that pop in and see dad, but often they don't understand everything that's going on. And although we know that they're trying to be helpful, often that can come across as a little bit critical, which is difficult. Particularly, you know, I'm 33, my brother's 38, I think. We didn't think we'd ever be in this position at our age. We feel completely out of our depth and completely clueless, and we're trying the very best that we can. And I think, I know none of those people mean any harm when they're trying to help out, but often it can come across as like that.
Are there other things particularly that you wish you'd been told earlier?
Yeah, so there's quite a few things, and things that we wish we'd thought of doing with dad earlier, so that he's kind of trained. So definitely using a camera phone so that he can send us, you know, if something's broken, he can just send us a picture of it rather than try and explain in words, because it's useless. Same with video call, because he loves it when he can see our faces, but we can't, it's such a struggle to get him to set this up. Just trying to, so one of the things dad, he was very proactive and very good, and again, really early on, I was really cross with him, but he gave us a list of how he would like to be buried, what he'd like to be wearing, all of his wishes. He gave us that in writing. He gave us power of attorney, but and now has no understanding. And at the time, we didn't know anything about power of attorney. I just thought it was a thing. So I was like, okay, we've got it. Actually, it's two things. You've got the financial one and you've got the medical one. Dad only gave us financial because I know he didn't want us to, you know, keep him alive when he didn't want to be. Actually, if we'd had that discussion, we'd know and we wouldn't do it. But, you know, so that would be one of the things that I absolutely recommend to anyone. Get that done even before anyone's ill. Just get it done. If you trust someone, make sure someone has that, because it is an absolute nightmare trying to, even when you've got it, trying to sort all the different bits and pieces out. Like, as a big general question, obviously you do all this research at UCL, like what is your ultimate hope from doing it, or what do you hope to achieve?
So the ultimate hope, of course, for all of somatic dementia, as for other things, is to be able to treat it effectively, so that people don't have to suffer as they do. And actually, you could say, well, we should be preventing it. It's a difficult thing to prevent, because in most cases, which we may come back to, it isn't genetic. So we can't do very, very good, accurate prior diagnosis, years ahead sort of things. It's very hard to predict who was going to get it later in their lives. But certainly being able to treat it effectively has to be the ultimate goal of research. But I suppose my own personal research is not geared toward experimental medicines, because my kind of view of that is, well, for a start, we don't really have good candidates for semantic dementia on the horizon, not really yet. But the other thing is that our understanding of the disease is so imperfect that a lot of what we need to do, I believe, is lay the groundwork for a much more thorough understanding of how it works as a brain disease. So in other words, you know, even beyond memory tests and things, be able to actually look at the physiology of the disease, how we can measure it, and how we can actually, for example, tell whether or not any form of intervention, treatment or not, is actually working. And then, you know, obviously, if we understood enough about that, then we could start to design treatments. And that would be the blue skies hope. You know, if you ask me where I hope we'll be in 10 years, 20 years, it would be at that level of understanding. So a lot of the research, my own personal research, and Chris Hardy's, is sort of directed toward finding understanding the mechanisms of how the pathological protein is pretty well understood in semantic dementia, but how it actually causes what it does, which is not very well understood. And then how we would measure those processes using markers and biomarkers and these sorts of things that you hear jargon that gets bandied about, so that we can diagnose it effectively, stage it, track it, and work out whether treatments are working. So those are my sort of, you know, personal sort of goals. And then for the field as a whole, the quest for treatment, of course.
Yeah, great.
Okay, so just I'd like to say thank you so much to Joey and to Jason for that video. And as Jason mentioned, that's just a very short excerpt of the full thing, which is actually, you might have noticed the sunlight. We recorded that back in July, I believe, which is very different to the weather I'm seeing outside my window now, and you can probably see behind me. But the full interview, I think, took over 2 hours, and we've I tried to cut some things out, but we managed to get it down to about 1 hour and 45, because there's so much fascinating insights from Joey and from Jason during that. So, sorry, Jason, did you want to say something?
Yeah, so I was just an ongoing battle with my technical aspects. I was slightly late this morning. Just to say, Chris and I get asked to comment sometimes about, you know, write things about semantic dementia and other forms of aphasia. And I think next time we get asked to do that, I'm going to ask Joey to write it, because I mean, it was just so insightful. And actually, she covered just about everything in the book and much more that's not in the books, but should be in the books, about semantic dementia. It was amazing to hear all that coming out. And I was just sitting there listening, intrigued for most of that, an hour and a bit, as Chris said. And those of you that are managing to sort of pick up on things, and there will be chances to look at that video in more length. And also, I thought the same thing actually about when Anna was talking about some of the tip strategies with Helen. You know, there's an enormous amount, even though we don't have a treatment, those things through disease-modifying treatment, of tips and strategies and things that actually just can help, from the simplest things that people might not even have thought about. So hopefully, listening to people like Joey and Helen, and then Anna and others talking about their experiences, will help people not have to travel that same long road again. You know, that they'll benefit from other people's kind of experience of living through these diseases. And I think that's one of the most important things that we can do. So Chris, I think I need to hand over to you for the Q&A. Is that right?
Yes, so that's right. So I'll chair this next session just to free Jason up to answer some of the clinical questions that come in. So I'd like to invite all the panelists to start sharing their cameras again. And Joey, can I just check if we've got you on the line somewhere?
Can you hear me?
We can hear you now. Yes,
Hey.
Amazing. So Joey is kindly joining us from her holiday, which is very intrepid and far above and beyond the call of duty. So thanks so much for joining us. So we've got sort of 30-35 minutes to run through some of the questions. Just to let you know, please do keep asking questions. If we don't get through them all in this session, we'll try to convene another session for us to record the answers later on, and we'll broadcast those subsequently. So I'll kick off by asking a question to Helen that's come in. So Helen, this is for you, and the question is, how can people, particularly healthcare professionals, support you best? What do you wish they knew that they don't seem to? Sorry, Helen, are you hearing me okay?
You, but can you hear me?
Yes, we can now, yes.
Yeah, I think the initiatives that you've shown today, where you listen to the patients, I think that's a really good thing. I would say more education from Queen Square or the people that are so expert at rare dementia to get through all the layers of where you get diagnosis from. So the GPs know a rare dementia, then people, the memory assessment places know a rare dementia. So I think that needs to be going down from the top, really, if it can, because I think sometimes when we go to support groups, I don't think we see the people that are doing the diagnosis, and so I think there's a bit of missing link there. But I don't know, because I don't know. From my experience, they didn't know at that much time. They've learned a lot from my experience as well, because the person that's done the memory assessment at the time now has seen what I've had to research, and she's gone back and thought, okay, well, I've learned from that. So it's just about education, really, in many ways. So I would say that would be helpful.
Yeah, no, thank you. I think that's so important, and you made some really helpful comments in that interview with Anna as well about things about situations that you find difficult and the ways that those can become easier. And Simon, I just wanted to check in with you to see if you had any sort of thoughts from the perspective of someone supporting somebody with PPA.
Thank you, Chris. Very interesting. I mean, I suppose it's you have a gamut of emotions that change over time. But I think what I've been so encouraged by these sort of care professionals have been amazing. Certainly the speech therapists, and I think Rare Dementia Support Group have been absolutely central. The diagnostic team, actually, of course, which come from a completely different sort of perspective, have been incredible as well. Especially Dr. Rosen, actually, over at the Horsham Memory Clinic, who's wonderful. It's sort of emotionally, sorry, but I think when you feel, what do you look at? I suppose when you look back and you think to yourself, over this time frame, there has been such a roller coaster of changes, and I'm just quite amazed, really, by how strong Helen's been, the support the family's been, and the people have been around us. So I know we're very lucky. We've been so fortunate. I mean, we've helped being able to research and look for things, but we've been very fortunate about the actual backup that has existed. So I mean, my only overview on this is that I think actually it has been amazing. Yes, there are areas to improve, and yes, we wish to help with this. And Helen was so right to say it's the interaction from stuff coming down from diagnostic to the care support team, but actually the reverse going back up as well. And that I think is what I would say. So that's in a positive vein. Thank you
so much. And yeah, I just sort of want to acknowledge how sort of brave and generous I think that all of you are being by doing something like this, by talking about things that are so emotional and so difficult. And it's so brave of you to want to share with us and to help the 80, 100, 120 odd people we've got watching. So thank you so much. I'll go on to our next question now, which Joey, I'll pose to you first of all. And this is a question about what aids are available to help somebody with semantic dementia communicate better or help loss of word meaning. And I just wondered if you'd had any experience of that with your dad.
Yeah, so I can't sort of pinpoint any exact things that we've kind of been necessarily given or directed to as such. I'm sure there probably was along the way, but some of the things that I've found most helpful with Dad is kind of, as his loss of language gets worse, trying to use visual things to help support the words that we're using. So, for example, there's one, he cooks chili. It's the only thing that he cooks now, and it's a loose form of chili at that, but he couldn't understand the recipe, so I just sort of rewrote the recipe for him and put images of all the different products that he used next to the word, so that he could see, you know, stock cube, and it was the same stock cube that he always buys, and there was a picture of that next to it, so he knew what it was. And then along with that sort of reinforcing words with images, he also Dad still functions very much by using his email, and so whenever, like, myself and my brother have a conversation with him, we then usually follow it up with an email in very simple language, but that repeats what we've said, you know, the main topic that we've covered, so that he can then sit down and kind of process it himself. I think he goes away and like researches some of the words if he doesn't know what they mean, so he's kind of got a written record of what we've talked about as well. I think we're quite lucky, and Dad is he's incredible with how he copes, and he is very proactive, and he's got all these different methods, but yeah, I think that's sort of somehow trying to use like a visual thing. Funnily enough, he would have never known what an emoji is, so, you know, the little smiley faces and things on your text messages, but he does still recognize those. So if you send something that is a joke and you put the laughy face, he then understands that it is a joke, I think, on some level. So yeah, trying to use images with words definitely helps.
That's amazing, thank you. And Anna, I could see you nodding vigorously as Joey was talking then. As our speech and language therapist, do you have anything to add to what Joey said?
Joey, do you know, you've basically described a research study where there was a study done over in the States with a person with semantic variant PPA, and they supported her to make a recipe, and they did exactly what you've done. So they made the recipe accessible with photos and images. And what I think what you've stressed here about kind of getting around language and words is one of the key things. So often I say to people, when you're using photos and images, it's really important to make them the photos and images of the things that your family member uses. So when you were saying that I used a photo of the stock cube that my dad uses, that's really important. I had a gentleman that I worked with, and he was a carpenter. I talk about him quite often. He's asked me to share his story many times, and he took photos of all his tools and all the equipment that he needed to do his job, and it had to be photos of his red hammer. And I've also worked, you know, he then kept those photos in a kind of key fob, so that when he went on into a hardware store, so the equivalent of B&Q, he would go in with the pictures of the things that he needed to buy in his B&Q. And the other thing that I have done with people, and I'm glad you mentioned iPhones, Joey, or tablets, is that I found that quite helpful. So often when people really continue to enjoy, you know, independence and going to the corner shop and going to the shops and doing the shopping, and one of the things I found really helpful is the photo app on a phone, which many people are used to using. It's quite a common tool that we use a lot anyway. So photographing things with the photo app. So for example, I had a lady I worked with, and when she'd go shopping, she'd photograph the margarine or the butter, the milk, the flour, and then she'd just match it to the object in the shop. So she didn't have to know what the words were or what it meant. It was kind of an object matching task, and she could still do it. And then finally, I'm really glad you mentioned about phone calls and writing things down, because the other thing I always say to almost everyone with all types of PPA at the moment is that telephone calls are really hard. So I try to encourage everybody to do video calls with family members, because video lets you use gesture. I'm a culprit. I use a lot of gesture, but actually a lot of the time people with semantic variant PPA or other types of PPA will find gesture helpful, and they themselves will use it too. So I've worked with a lot of people with semantic variant PPA who actually are able to keep using their gesture to communicate when they can't think of the words. So video call just helps that process.
Yeah, that's amazing. Thank you so much, Anna and Joey, for your insights there. And I'll move on to the next question. So this person says, I have non-fluent PPA. I understand that the damage is to the left part of my brain, and I think I have a good idea of what faces me from that. But my question is, what is the likelihood of that degeneration passing to the right side of my brain? And if so, when will that happen in relation to the general progress of the disease? And this person's trying to get a sense of the possibility of a happy internal life in the later stages. So if it's okay, Jason, I'll come to you first to talk about sort of the neuroscience, and then Nikki, I might come to you to talk about living well in the later stages of PPA. So Jason.
Yeah, no, thanks. It's a good question. I just wanted to say, just to follow up the last question, it's okay, just to say that I think that what Anna and Joe were talking about is really the broader point here is playing to strengths. So one thing about PPA that sometimes can easily get overlooked is that, you know, a lot of aspects of a person's brain function is there and can be used. So for example, the object matching thing and kind of people's ability to kind of find ingenious ways around things, around their language problem, can still be there. And of course, the broader kind of theme which Chris's research work picks up on is to look at that scientifically, look at actually the, you know, the plastic brain, which is kind of the brain that kind of adapts to things. And that is, you know, something that brains do. And it's still true even in PPA. So I think it's really important to be thinking about those sorts of things. And it does actually then lead into an answer to this question, which is the kind of balance of the different areas being involved. So in general, because the left side of the brain is the dominant one for language, it's called the dominant hemisphere, but that really just is because we're very biased toward language and the way we think about things. You know, the right side of the brain is dominant for other things, non-verbal things, but for verbal things, the left side is dominant. So most forms of PPA tend to strike the left side of the brain in people who have the conventional way of lateralizing the side of where their language is in their brain. Very occasionally you'll find people where the language sits in the right side, or it's split between the two hemispheres. It's slightly more common for that to be the case in left-handers, but even most left-handers still, their left hemisphere is their language dominant hemisphere. So that's really, by definition, that tends to be the one that takes the brunt, because that's what we see as the start of the disease. And the other thing to say is that it does indeed, as the question sort of said, implied, it does tend to spread over time, but usually the functions of the brain that are in the other hemisphere take quite a lot longer to become involved. But unfortunately, they do tend to be a bit involved by, you know, if we're looking at the very long range, by the later stages of the disease, that can tend to happen. But it's very unpredictable. So I can't give you an honest answer to the question about when. And even if we knew, you know, clinically we had you sitting in front of us as a patient, that would not be possible really to answer honestly. It tends to happen gradually. And you might say, well, how would I know if this was happening? The sorts of functions in the right side of the brain are much less. I mean, language is pretty poorly understood, very complex, but even less well understood is all these other non-verbal, because they're to do with things like emotional behavior, social behavior, processing of other people's signals that are not verbal signals, like, you know, facial expressions and that sort of thing. And so that those functions, and also the kind of other, when we're talking, the things that are not actually what we're saying. So for example, we talk about the melody or prosody of speech is probably more on the right side. So, you know, that can start to change. Your ability to pick up on other people's tone of voice, those sorts of things can change. So they're the sorts of things. It also can affect sometimes things like spatial awareness too, which is probably there. But really, in an individual case, I usually say to people, because we can't give you very accurate information, in some ways it's not that, might not be that useful to fixate on this and say, oh, you know, how long have I got till this starts to be affected? Because in some people it doesn't ever really get much affected. In other people it can be more affected. It's unpredictable. So, you know, one of the big themes in the research, which is again a large component of Chris Hardy's research, is to try to come up with a way of actually accurately staging this. And many of you have helped with this initiative. It's ongoing, coming up with ways that we can actually take a person's symptoms and work out where they actually are individually within the disease, which hopefully will start to answer some of these questions more accurately. So all we can really say at the moment is it does start in the left in general by definition. It tends to spread to the right, but the rate at which that happens and the extent to which that happens is still unpredictable in an individual case. And so we do advise people in general to try and focus on what's in front of them and harnessing the aspects of their brain function that are still working pretty well, which often is, you know, quite a bit, surprisingly, around the language problem. So sorry, I should hand it over to Nikki. Sorry to talk so long.
Thank you, Jason. That's great. I'm going to sort of talk a little bit about sort of later stages and sort of tailoring support sort of to people's needs. And it's really, especially sort of you've come in with this question of what's going to happen later stages, how, you know, how can I look at later stages? And it's looking at people's individuals sort of needs and tastes and desires and what gives them pleasure. And Helen's a great example here of, she is a complete lover of music. And I'm sure she will want music with her forever, basically. So this is going to be something that, you know, Simon can really tune in for. And listening to Joey today, how she is with her dad, which is so uplifting. One of the things that Joey sort of says is, I want to bring a bit of joy into every day. So, you know, if you are in that early stages, or, you know, you're a family surround looking at that, get your advanced care planning in now. And advanced care planning isn't about finance. It's not about making those medical decisions together. It's actually about well-being as well. And that is so important. I always sort of try go to the mantra with the people that I deal with on a daily basis of don't count the days, but make the days count. And that's really important for sort of later stages, that you have made your wishes of what sort of things you really like. Do your family know you really well? Do your friends know you well? They don't want to come around and just put music on and put on classical music if you just love rock music. That's not going to suit you. So it's really important knowing people's individuals' tastes and sort of not boxing things into, oh, what do people with PPA like? It's not that. It's about you, that person, what you like, and making those plans with your family to, you know, later on as things get changed, you know, how can my mental well-being be at the top? That is really important to people. So yeah, I suppose my words of advice for that is start your planning now and make it really intricate and make it exciting.
Thank you so much, Nikki. Does anyone else want to add anything onto the end of that?
I wouldn't mind just saying something, if that's all right, Chris.
Yes,
I think what Nikki said there is absolutely spot on. I think when you first get the diagnosis, it's really, really hard to have conversations about when it gets worse, and, you know, talk about, say, like, what does that person want, you know, for their end of life, or what do they want in terms of care, and the person that is ill, I think quite well with my dad, he was very shut off to, he just didn't want to talk about it. And I think partly that was the illness, but I really wish we'd pursued with it, because what Nikki said is so spot on. If we'd got a better idea and we'd already had those conversations when he had the language to do so, it would make life now a million times easier, even if it was really difficult to have those conversations then. Now it's too late. And that's exactly the kind of advice I wish we'd been given, you know, at the start. And perhaps we were given it and just didn't listen to it. I don't know, but yeah, I think what Nikki said is golden.
That's very good feedback, Nikki. Sorry, go on, Anna.
I wanted to add that a gentleman I worked with, he said that writing his advanced care plan was like a communication aid, a way to keep his voice in his future. And I thought that was really powerful.
Yeah.
I'm going to steal that one, Anna. I like that. Keeping your voice in the future, definitely.
Can I just say, because Nikki reminded me of something when she was speaking about and it might be true of a lot of things that we think about, is so there's a line of Philip Larkin's, which is one of my favourite lines, many favourite lines of his, but where he said, one of his poems, he says, "Where else can we live but days?" And that's actually it's quite deep. I mean, I think you know, you have to kind of try. I think everybody, all of us, really, have to try and live in the moment to some extent. And you know, it's one day at a time, because we don't know what the future will bring. I mean, COVID has illustrated this, but it's also true, unfortunately, of a lot of brain diseases. So making the most of the day is very important.
That's lovely. Thanks, Jason. I think you know you're a neurologist when you can quote Larkin off the top of your head without reference to any materials. So that's fantastic. You
have to be elderly, Chris. That's all it is.
We'll move on. This question has just come in, actually, and Helen, I might pose this to you. So the question is, what are your tips for living a life that isn't defined by PPA?
I think my life is, in a way, I have in my professional life still working. I think keeping going in working for me is a good thing. I enjoy the work I do, so I think I'm happy to do that. I don't want to be defined by PPA probably, but you have to acknowledge you have it and just be kind to yourself and do things that I am supported by my family, which is, I think that's an amazing thing. You have to have a community of people around you. You can't be the communicator that you were. So you have to have a family, you have to have people around you that learn how to communicate differently from you. Have I answered the question? Because I can't remember what the question was now.
No, that was perfect. Thank you so much. That was really nice.
Yourself, I think things you can do is get yourself out of situations where you get tired. Go and have some sleep. Don't use your language. When people go, "Oh, you've got to have lots of conversations," that's just too tiring. Just take yourself out and have a walk or play the piano or do something that's not related to language.
Yes, no, that's you've answered the question perfectly. So thank you so much. I'll move on to the next question, and this is it's for Simon and Joey. And the person says, a PPA diagnosis can shift the dynamic of a family. What are the challenging things about this, and are there any good things that you have found to come out of this? So it's a tricky question, and it's not one I've given you in advance. But Simon, I don't know if you have any thoughts about that.
Thank you. The dynamics, interesting, really. Yes, I mean, of course they change, but they're subtle. And really, what Jason was saying, actually, you know, by living each day, of course, actually you don't pre-plan. There is no route map to follow, so you are quite reactive. But I think we, you know, have tried to find humour. Everything has to be light touch, and I think, you know, the way forward is it's family sport, obviously, you know, with the emotion of that. But I think actually, as an individual and as a couple, there are slight changes to that dynamic. Of course, your relationship inevitably changes, but you don't. It's not like it falls apart or changes negatively. It actually just reconnects a different way. We take great solace as a sort of practical example. Every morning we do a quiz together, and Helen reads this, and it's a very good way for Helen to practice language. and the words with multiple syllables that she finds difficult. And it's also good for me to really try and understand what Helen's trying to say too, without, you know, so I really have to work hard. So it makes me concentrate more on what Helen's saying too. So these are really sort of small things, but actually dynamically that really matters to us. And funny enough, we really miss that if we don't, because I'm still working too, and I'm sort of involved in sort of advocacy and sort of different world of language. So actually to get us to talk together in a quiet environment over breakfast is a really good thing. So there's an example, but you know, these changes are subtle, they can be profound, they tend to be retrospective when you look back and you think, well, that's changed, but you adapt, you know, and that's the great thing, and reconnect in different ways, if that helps.
No, that's so helpful, and I think beautifully put, so thank you. Joey, did you have any thoughts about that question?
Yeah, I think like Simon says, I think sometimes the change happens without you kind of realizing it's happened and how much it changes. For me personally, I quite like at times trying to remember still what it was like the other way around. Obviously, I guess at some point in your life you do probably end up looking after your parents, or at least one of your parents, as they get older, but it's a strange phenomenon when you become the one that is looking after them. And I was going through my inbox, which was needed clearing out because it hadn't been cleared out for about 15 years, and I found some emails from my dad just when I was back at university, and it was really nice still remembering, sort of reading those and remembering then what he actually was like, who he was, and I'd sort of encourage people that do find themselves, you know, in this situation, that to keep hold of, I don't know, letters, or if you've got emails or cards or whatever it is, just something that kind of you can read and remember, oh, actually, you know, he was a really intelligent, funny guy, and so you don't just then remember them with the illness and get really, like, I get so frustrated with him, if I'm honest, and that can be really hard. But then when you have a little moment where you remember what he was like, and you know what he would have done if it was the other way around, you kind of remember that, and it helps. I think that helps you to keep caring and keep doing as much as you can, because you remember the person that they were. So I think that's really important. It was a slightly upsetting moment the other day, but we sort of had a hug, and because he'd upset me, and he realized he'd upset me amazingly, because he doesn't normally know, and he gave me a hug, and it was a hug like he would have 10 years ago when, you know, I was upset and he was my dad and looking after me, and sort of just getting those little glimmers, those little moments, whether it's by reading, like I say, something from in the past or whatever. I think that's quite important, because the relationship does completely change, and you want to still remember them as they were as well.
Yeah, thank you so much, Joey. I think, yeah, again, it's so beautifully put, and so generous of you to share those thoughts with us. Anna, I can see you've got your hand raised.
I just wanted to add something. As both Joey and Simon were talking, it reminded me of something the wife of somebody said and did, and it was quite similar to what you've both described. So in speech therapy, we often video record people, as Simon and Helen know. We do a lot of video recording, but I'd done this with a couple, and after we'd done the therapy, the wife actually kept video recording snippets of their life together. And like, as you, Joey, mentioned, she was using it as a kind of to look back on and have, and she sent me one of them because she hadn't thought of how lovely it was to have these video recordings. And it was a video recording of her and her husband having a snowball fight, and it was a couple of years ago, and it was he'd been living with PPA for many years, but they just video record themselves having a silly snowball fight in front of their house as they were walking home. And she said these were the kind of things that she was treasuring all the time, and by video recording them she knew she could keep treasuring them. So I just wanted to add that to the ideas that you already suggested.
Yeah, that's a wonderful suggestion. Yeah. Sorry, Jason, go ahead.
Yeah, yes. No, I was just going to say, it reminds me that there's you know, it's exactly right. And the sort of this idea of voice banking for people whose voices change over time, and it's more common, of course, in the non-fluent side, but that is another, you know, a very emotional thing. It's not just what people say, it's their voice, their identity. But of course, one of the potential, slightly, if there aren't that many, but one of the possible spin-offs of the whole COVID era might be that we've suddenly got masses of material potentially around to keep these documentary records. So I think that it's very important to have time capsules. I think that's absolutely right.
Great, thank you. Did anyone else on the panel want to add anything? I think they've answered that really nicely. So we've just got time for one more question. I'm afraid we've had, I think, something like 30 come in, and we've managed to answer 5. So you can see how popular our panelists are today. I think it's the most questions we've ever had submitted. So I think Helen, Simon, and Joey, that's probably more down to you than down to any of the staff, any of us. So I guess one question that interested me when it came in was, this person asks, are any of the senses heightened by PPA? My wife's sense of smell, hearing, sudden loud noises, and taste are far greater than mine. Also, my wife appears to be more sensitive to pain with small knocks that would not bother me. And so, Helen, Simon, and Joey, I just wondered, first of all, if you had any thoughts about that. Have you noticed sort of any increased or decreased sensations?
Oh yeah, yes, I would say I hadn't really factored in that I would find noise really irritating. Yeah, that's massively a difficult thing. I can't stand if you're in a room and somebody's clattering out with saucepans, so you'd feel really edgy. I would say that's a really. And I think, just to say, I think in the short film, it didn't show that the hearing problems is a problem. I think what you're finding from the research, I think I can't speak for you, Chris, but my hearing is I don't hear accents, I don't hear mumbling, I don't hear so much, and I couldn't really write. I've always had what I thought was pin sharp hearing. And I've realised now I don't hear things in terms of people's how they project themselves. Some people are more clear than others in terms of how they speak, so I can hear how the stress of it. If they're speaking in a way that isn't what I considered putting the accent on the right bit of the sentence, I completely lose what they're saying, and I don't even understand what their question is. So I think Simon one time did the quiz for me, and my daughter was in the room, and she said, "Dad's making perfect sense," and I said, "Can't understand what he's saying. I couldn't even hear what he was saying." So it's challenge for everyone to. You can't ask people to change their accents, but you have to put the subtitles on, and you don't hear what they're saying. And I think I hadn't realised that it's not, for me, it's language, and then it goes into processing as well. But that's just me, and obviously I always say everyone's journey is every individual is different, aren't they?
No, thank you. That's really insightful. Sorry, Jason.
It's not just you. It's not just you, Helen. It's in fact, you've just encapsulated a lot of what we've been trying to get across to our colleagues and the wider scientific community. It is in fact a big issue, the whole issue of processing of sound. And people do get these very unusual combinations that are hard to understand why it should be, of becoming, on the one hand, sometimes really sensitive to sound, unpleasantly so, and yet also becoming unable to understand some types of sound. So it's all, this is because I think it isn't an ear problem, it's a brain problem, the hearing brain. And we've got Chris and I have just, with Jeremy Johnson, who's our sort of fellow working on this at the moment, we've got a piece coming out where we're trying to actually make a call to all the neurologists, coming out in one of the neurology journals very soon, about exactly this point, which will hopefully speak for a lot of you when you talk about the changes in these functions. But and of course it's other senses too, which we can talk about if there's time, Chris.
Thank you.
No, Thank you, Jason. And Joey, did you have anything to add to that?
Yeah, like Helen said, I think obviously everyone's experience is quite unique, depending on their dementia. With Dad, he particularly is very heightened to being cold, well, less hot. He's cold nearly all the time, and also he's very sensitive to any sort of pain. So, you know, what might be a stone in your shoe and it be a bit annoying, to Dad that is really awful, excruciating pain in his foot. And then on top of that, the other thing that he's kind of very sensitive to seems to be like certain tones. So initially it's he won't listen to any music. So lots of people say, as soon as you say dementia, lots of people say, oh, if you listen to music it brings back memories. For Dad, if he listens to any sort of music he cries. And recently we've been told that actually it might not even be the song, but it's to do with certain tones, because not only is it music, but things like the phone ringing or his razor, the sound of his electric razor, it makes him cry. There's sort of like this automatic reaction. So that's a bit of a weird one. I don't know. I don't really understand it myself, obviously, but yeah, they're sort of the things that he's particularly sensitive to.
Yeah, no, thank you. And you talk in a lot of detail in the longer interview that we have with you on the website about some of these observations that you've noticed. And yeah, so just to the person who asked that question, I guess, yeah, you aren't alone, and these are things that we don't necessarily fully understand yet, but we need to do more research and come up with ways of helping helping people to manage these things. I think we're out of time, so I might call it to a close there. What I would say is that if I'll talk to all of the panel members just after this, and we might try to reconvene at a further date just by ourselves to record some answers to the questions that we didn't get through. And what we did last time is we've clipped those up, we've put them on our frequently asked questions part of our website, and they're all subtitled. They're all up there as individual questions and answers, and we'll try to do that hopefully again with the questions that we haven't got through today as well. So I guess I'd just like to say a really big thank you once again to all of the panelists, and particularly to Helen, Simon and Jerry, who it was just absolutely incredible listening to all of your wisdom and insights, and it's so powerful for us as professionals to learn from people who really do have, you know, the greatest expertise of all. So thank you so much for being so generous and brave in sharing your thoughts and your wisdom with us. And I think that's it. So sorry,
I just wanted to give a vote of thanks to so that we don't forget in all the excitement, to thank you and Anna and Nikki for being so instrumental, in particular, in bringing this all together. I mean, it's a huge amount of work to bring it together, and I do hope it's been useful for people. And just to leave you with the message that really no one is alone. It will feel like that, I know, but we are here. The direct support team is here. So if people want to communicate after this meeting, that's a good thing. We'd encourage that. Okay, thank you.
Thanks, Jason. And yes, just a plea for feedback as well. So we do take things on board. The reason we did the videos and the way we did today was so that we could subtitle them, because we know that, you know, from Helen's experience, that's really helpful for some people with PPA. So if there's anything that we can do to try to make things better for you in the future, because, you know, it looks like we might have to do these meetings as webinars for the foreseeable future. So please do let us know. Anything you liked, anything you didn't like, it'd be really lovely to hear from you. So I think that's it. So I'll ask all of the panelists to turn off their webcams and to wave goodbye, and then you'll be left with a fundraising video from the National Brain Appeal. So thank you so much, everybody.
Hello, my name is Eva Tate, and I'm the Major Appeals Manager and Manager of the Rare Dementia Support Fund, held by the charity the National Brain Appeal. The National Brain Appeal raises money as the dedicated charity for the National Hospital for Neurology and Neurosurgery and UCL Queen's Square Institute of Neurology. The National Brain Appeal raises funds for Rare Dementia, supports 2,000 members to help individuals living with rare and early onset forms of dementia, their families, friends, and healthcare professionals. And we also hold several other funds for FTD and dementia research. The funding helps not only the support group meetings in London, but also the regional support groups, admin and support staff, and all other associated expenses, including the new online support groups. When things return to normal, there are travel and accommodation bursaries available to help members attend the meetings. This year, we've raised our fundraising target to 300,000, and this will rise further to 350,000 by 2022 to develop and extend the service in the areas of education, support, and research, with the ultimate aim that everyone affected by a form of rare dementia will have access to specialist information and support, as well as contact with other people with a similar condition. We apply for grants from grant-making trusts, foundations, and livery companies, and have a wonderful group of supporters, some of whom are here today, who fundraise for us in an amazing variety of ways. We would love it if you would like to sign up to our RDS fundraising newsletter to hear more of these stories and receive news of how we can support this community. We have had people do head shaves for us. We have had a gentleman drive across the Mongolian steppe in a VW Polo, and we have lots of people who take part in runs and virtual runs as well. At the end of February, we held a gala dinner called Mission Possible, where we raised 110,000 for the expansion of rare dementia support. And we are delighted to announce that in line with this expansion, the charity is committed to raise up to 7 million to create the world's first centre of excellence for rare dementias. If anyone would like to discuss any fundraising ideas or the new capital appeal, please do feel free to email me or my colleague Alexis, our Senior Fundraising Manager, who will speak about the innovative new ways you can be involved in fundraising for RDS, even during this challenging time. Thank you very much.
Hello, my name is Alexis Gebby and I'm the Senior Fundraising Officer at the National Brain Appeal. I just want to start off by saying a huge thank you to all of you who already fundraise for RDS. We really appreciate all of your incredible efforts, especially at this difficult time. My role at the National Brain Appeal is to look after all the amazing people taking on various fundraising activities for us. We have had people challenging themselves to run marathons, cycle long distances, climb mountains, and even take on skydives, all whilst raising money for RDS. We also have wonderful fundraisers out in the community who organise golf days, hold coffee mornings, host choir and carol concerts, and even shave their heads. These people ensure that more people like you can be supported through rare dementia support. If you're interested in becoming one of our fundraising heroes, then please do contact me. I am here to support you with your fundraising, and I'm more than happy to chat about any ideas that you may have. While at the moment it isn't possible to take part in a sporting challenge or hold a big fundraising gathering in your local community, we do have some fundraising ideas, such as taking on a solo virtual run or walk, hosting a quiz for your friends or family online, asking for birthday donations in lieu of going out, or even donating money that you may be saving by not travelling to work or buying your daily coffee. Do get in touch with me if you would like to get involved. In the meantime, take care and we hope to see you soon.